We are perilously close to losing the single most important aspect of our democracy, Medicare. We've had universal health care since the 60s, but we had to fight tooth and nail to get it, and we continue to fight tooth and nail to keep it. But the cuts have continued, forcing hospital closures and the firing of healthcare workers. These cuts have cost us.
People died waiting in ambulances for access to emergency rooms because the ERs were full. Ambulances had nowhere to stop. Hospital beds were closed. People were, that was really the beginning of the really big public stories of people waiting on stretchers in hallways. They closed hospital care without replacing it in the community. These things happen all across Canada.
The Canadian Health Accord, signed by the provinces and the federal government in 2004, was intended to stop the cuts and guarantee continued federal funding. This agreement ends next year and must be renegotiated. But Stephen Harper won't hear of it, opening our healthcare system instead to the highest bidder.
You know, one of the large owners of nursing homes in Ontario is an Australian mining company. This is about profit making. It's not about good health care. It's a bad way to organize your healthcare system. It actually drives up costs and it takes money away from care. It doesn't improve care at all. These entities are owned by shareholders who might live halfway around the world. They don't know whether your grandmother or my grandmother is getting good care, and they, aren't in it for that anyways. They're invested in order to take the most profit out as possible.
How is it that a country that so deeply identifies with good health care could find itself at the precipice of losing not only what it values most, but what defines it as a country?
The evidence is mounting up. The antipathy that Stephen Harper and the Conservative government has towards Medicare, I think, is becoming more and more overt. In the most recent budget, they cut funding for refugee, veterans, and RCMP health services. They cut and intend to close the Health Council of Canada. They refused to renegotiate the Health Accord and instead announced their intention to cut funding towards the provinces by $36 billion in upcoming years.
This is the worst government we've ever had in this country. I don't have any faith that he'll do the right thing. That's why we're turning to the premiers and saying, you have to speak to him. You have to be strong with him because he is ideologically committed to killing our public health care system, and I don't think there's anything I could say that would change his mind.
At the Premier Summit this July, provincial and territorial leaders met to discuss the Health Accord, but nothing came of it. No promise to push Harper to the bargaining table, no plans made to ensure the accord would continue. This means it falls on us, once again, to create the change we want to see. We are running out of time on those things most dear to us: our health, our health care, and our democracy.